for live stream.
Yep, I got it.
I'll record this to the cloud.
Then you have this really strange delay for a minute, don't you?
It's okay. What's up, guys? I think we are starting to come through here on Facebook. There we go. Always takes a minute or two. So tonight, Kirstie and I are going to dive into helping women over 40, dealing with menopause. I know it's a big struggle. We have a lot of people in the group constantly asking questions, figuring out like what we can do to help with the weight loss because you guys see a huge increase. I talk to everybody in the DMs and I hear a lot in postings. So you get that 20 to 30 pound increase. And we're going to dive into some tips, tricks, some things you guys can start to really look at and implement. Kirstie's really going to take the handle on this. She's helped over 300 women over the age of
Mhm.
40. Yeah,
Yep,
so she
yep.
has a very good mindset on this and experience. So she will definitely um, explain some things and I'm gonna learn, you guys are gonna learn, so it'll be a really good night. We'll try to keep this between 20 to 30 minutes because she's out there on the East Coast, so it's like what 8:30 there and it
Yeah,
is
it's my
5:30
bedtime.
here.
Yeah.
Yeah, it's bedtime over there, which is funny because I usually have clients do. We usually do our lives on Tuesdays at 5:30, and my other people on the East Coast are like they're like in bed.
Yeah,
Yeah.
absolutely. Yeah,
Yeah.
for
So if anyone,
sure.
oh yeah. So if anyone has questions, throw them in the chat. We're going to go through a couple different topics that we both heard a lot of, over the years with training and coaching people and some things you guys can really think about and start to implement into your day to day. So is there anything you want to start with first, or should I kind of go off our typical questions that we kind of went over?
I think before we get started, it might be helpful just to do some definitions here because there's
Cool.
sometimes some confusion. So there's sort of four stages to this whole menopausal transition, right? So you've got premenopause, which is your normal regular period, happens every month on the 28-day rough cycle. And then,
Okay.
so that's premenopause. Then you go into perimenopause. And this is the part of life where your periods will start to be irregular. Your estrogen starts to be erratic. It'll suddenly go up and suddenly go down. Some women will start to have much longer cycles or much shorter cycles. You can get lots more bleeding, like lots of heavy periods, maybe even worse cramps. And it can be totally erratic. And that can be anything from like 4 to 7 years, right?
Okay.
And then you will eventually get to the point where you stop having periods. Now, menopause is actually the 1 year anniversary of your last period. So it's actually a 1 day is menopause. And then you are post-menopausal, right? So you are going to
Okay.
spend, the average woman is going to spend 30, 40 or longer years of her life being post-menopausal. If you are lucky enough to live long enough, every woman on the planet's going to go through it, right? The joys of it.
Yeah.
So, and that,
Can't wait.
yes, I know. Don't rush. So
No,
those are
no,
the
definitely
four
not.
phases. Those are the four phases of it. The other big myth I want to bust for a minute is when you get into the perimenopause stage and you start to notice those changes happening, you go, okay, something's happening. There's a huge market popped up in the last few years of like stuff for menopausal women. So there's over-the-counter tests. There's lots of rather unscrupulous practitioners out there who would love to sell you a hormone test or whatever else is out there. There's no such thing as testing for perimenopause. I just want to put that out there, right? So if we're still in
Okay.
perimenopause and you're still having a cycle, whether erratic or not, think about a regular cycle, right? Your hormones change as you go through the month. Some points you've got high estrogen, some points your progesterone's higher because your uterus is being lined. All that's meant to cycle, right?
Yeah.
So there's no 1 day in the month where you could take a measurement and go, this has changed. You would
All
literally
right.
have to take 3 measurements a day over the course of your 28-day cycle to know what your cycle is. So
Okay.
if you suddenly see all these ads for a test to see if you're in perimenopause or menopause, they're a bit hokey. Don't worry about it, right?
Yeah,
All
that's
of
good.
the reputable MDs out there and specialists, gurus, if you want, in this field will say to you, does it even really matter where you are in the cycle, in the phases? It's more important that if you are incredibly symptomatic to the point where it's debilitating, that you treat the symptoms. Do we actually need a diagnosis or do we need some treatment? Right?
Okay.
So
Yeah.
yeah, just be careful about silly products out there.
Yeah, that's definitely a good tip because I'm sure,
Okay.
we all think that there's a one way to figure stuff out, and that's a good point because I had no idea. Yeah, Leah says that was going to be her question, so that's good. Yeah, if you guys have any questions, if you're just tuning in, like throw them in here. We're gonna, like I said, we'll dive through some stuff, but
Right.
it's always good to see what questions you guys might have that we maybe didn't think about. So,
One of the
how's
questions that will probably come up, and since we've just talked about like tests and stuff, if it's okay with you, Megan, I'll just dive into
yeah, go
HRT,
ahead.
hormone replacement therapy. It's going to come
Yeah,
up at some point.
yeah,
Um, this is a conversation between you and your doctor. That's kind of where I'm going to start with this. No one else can tell you what you should do. There's a couple of things I do want to say though. The vast majority of OBGYNs get absolutely no training in menopause care. The vast majority of their training is basically get a woman pregnant, keep her pregnant, deliver a healthy baby.
yeah.
70% of their training is the OB part, very little of it is the GYN part. And if they've done any menopause training at all, it's either been a CEU or it's been like one semester. There's very few
Okay.
OBGYNs get any training at all.
Yeah,
Primary care physicians basically get none whatsoever. So there's very little
yeah.
training out there on it. And those who have done any studying, physicians that is, on HRT have probably read the Women's Health Initiative study from the early 2000s, which was flawed and is very much debunked. There are newer
Hmm.
studies, but a lot of physicians are not up to date. There is a website called the North American Menopause Society, NAMS for short, and they have a whole database of approved practitioners who are trained, skilled, certified, etc. in menopause. So if you are looking for someone who can actually have a knowledgeable, educated conversation with you, I recommend going there to find someone.
There you go.
All right. So
Yeah, that's
that's all
definitely a
that
huge.
stuff out of the way.
Yeah. Yeah, that's
Yes.
huge right there for people, you know what I mean? Like, I mean, that is true with the OBGYN. I feel like every time I go, they're like, "Are you gonna have kids soon?" I'm like, "No, I don't want any." Like, that's all they're worried about. I'm like, "No."
Yeah,
Yeah.
for sure. So those
Yeah.
are some helpful resources. Hopefully that debunks some myths because there's a lot of them
Yeah.
out there for sure.
Yeah, sure. Because Leah says she just bought a clear blue test yesterday, but hasn't used it yet. So I don't know. I'm not familiar with those, but I'm assuming that's what that was. What we kind of went over.
I thought that was for pregnancy, but all right.
Yeah, I don't.
I didn't know they did a menopause one now. But everybody,
Okay.
if you actually, Megan knows this from a business and marketing perspective. There's a thing you can do on Google called Google Trends,
Mm-hmm.
right? And you can literally see the trend in a search term that people have typed into Google. If you go there and you look at menopause, the last 2 years it's gone.
Oh,
Well,
skyrocket. Yeah.
people are searching it, then people coming out with products are going to be right behind it,
Yeah.
right? So there's a
Yeah, that's
market.
what the thing is. Yeah, you gotta
Yeah,
watch out for stuff like that for sure. All
yeah.
right, cool.
So I
Yeah, I don't know if you
suspect
have any questions. Yeah.
the biggest question you get is about the weight gain, I'm guessing.
What is it? Oh, weight gain? Yes, I
Yeah.
get a ton on the weight gain side. So I don't know anyone watching like that's gone through it so far can always type it in. But most people that I talk to they're gaining anywhere from that 20 to 30 pound range, which we kind of dove into. Peri wonky periods. Bev says she's like, are you asking like, are you getting wonky periods on when you're perimenopause, Bev? I'll wait for her to reply. But yeah, like I see a
Yeah.
lot of people that they're like, I gained this amount of weight. And we talked right before this. Oh yeah, she's saying yes. Yeah, so you're getting the peri, you're getting the wonky periods, right?
Yeah.
Yeah.
Everything gets a bit erratic in peri. Yeah.
Okay.
Yep.
Yeah, so like longer, heavier, you know, not always the 28-day cycle.
No.
Yeah, I know some people are gonna be jumping in probably now.
Yeah. Okay.
Yeah,
Cool.
yeah. We get like I get a lot of the 20, 30 pound weight gain DMs saying, like I'm going through menopause, whether they're like in between it. Okay, that's where Beverly. She's like, that's where she is.
Yeah.
So it is a struggle, and we talked about this right before we got on live. So there's a couple of things you guys have to be super mindful as you're going through this stuff, right? So really dial in that nutrition. I have way too many people over the age group of 40 that are under eating. And for my clients that are that over that, like I've increased so many people's caloric intakes from what they were doing to now, and they can't believe how much food they're eating and losing weight and losing inches. So
Right.
that was one of the things we do definitely. And the protein intake, I nail the head that in my group all the time. Like, you guys got
Yeah.
to increase your protein, increase your protein, increase your protein. So that is very important. And if you're not tracking that, like, be sure to download my Fitness Pal. It's free. Figure out how
Hmm.
much protein you're eating. Because most people, I don't know, Kirstie, if you ever deal with this, but when I first work with clients, they're usually somewhere between like maybe 60 to 80 grams at the most of protein. Yeah, you too.
Right.
Um, and the goal is always to push them over that 100-gram mark, so that way they're getting in a decent amount.
Yeah. Yeah.
So
Yeah.
yeah,
And
so
obviously,
that
depending on how much strength training you're doing and how much weight you're lifting, you might want to adjust based on that. Yeah. Yeah.
hmm
The general
yeah,
guideline is 0.75 grams per pound, I think. But
yeah.
there's
I
a
always get I get people the 1 gram per goal body weight, just because it's just a lot so easy for them.
yeah,
Um, and
perfect.
then you can adjust from there too.
Yeah. Yeah.
Yeah.
And I think if we may,
Yeah. Yeah.
question you get a question I used to get a lot, and just so the audience is clear, I did weight loss, very specifically
Yes.
weight loss for women 45 plus. And the very first question I always got is why? Like, why? I'm not doing anything differently. And no, you're probably not. And unfortunately, the things you could get away with pre-menopause, can't get away with them quite as much. And it all comes down to estrogen, ladies. I mean, that's basically what it comes down to. When you're postmenopausal, you basically lose the strongest of your three estrogens. And it is an incredibly powerful hormone with big knock-on effects once you lose it. So you immediately have increased cortisol, you have increased inflammation, you have a hormone called leptin that helps modify your appetite. You're going to get a decreased leptin sensitivity, so you're going to be hungrier. Thank you, estrogen. Such a wonderful hormone. You're going to lose muscle mass much faster, and your calories are burned in your muscles. So if you've less muscle mass and you eat the same, you're actually eating more effectively. You're going to have decreased insulin sensitivity as a result of your estrogen. So you eat a carb, and for God's sake, please don't translate this as cut carbs. Please don't do that. But when you eat carbs and they're converted to blood sugar, your insulin is not going to be as effective because you've lost your estrogen, and your thyroid function changes. So you have this whole like cascade of effects that happen when you lose estrogen. And so, unfortunately, lifestyle changes have to come into effect here to adjust for that. So, as Megan quite rightly says,
Right.
you're probably not eating enough. I guarantee you're not eating enough protein. And you're probably not quite doing the right kind of exercise. And Megan can talk to this just as much as I can. Pick
Oh,
up a
yeah.
weight.
Yeah. I
Please
always
pick up a weight.
exactly please pick up the weights. Yeah, because that's always a thing too. Like, I have a lot of clients that are, over the age group, and they haven't really worked out in a long time. They're like, they'll do walking and things like that, which you'll initially see some weight loss, but you really want to incorporate that strength training in there to help, right? We're losing that muscle as we get older, so we have to make sure we
Yeah.
supplement it with that strength training and the proper nutrition. So that's huge. Another thing, I know you talked about cortisol levels, so your stress. Like, as we get older. That is super, and stress levels are a big factor in weight gain, right? That is
Absolutely.
huge, especially with everyone's career here. Like I have a lot of frontline workers here, right? So you
Mhm.
guys are stressed out on a day-to-day basis at work. You're maybe not eating correctly during your 12-hour shift, and then you're just
Right.
in that constant like almost like that fight or flight kind of feeling at all times. So that is a huge game,
Definitely.
like thing that's going to play into effect as well.
Most
Yeah.
definitely. Most definitely. And then the other one, I always used to call it my 5 pillars, which is like appropriate nutrition,
Mhm.
appropriate exercise, hydration. I hate to say it, but most women are chronically underhydrated, and that's again super impactful in terms of your muscles and your joints and so on, and just your digestive system working properly. Stress, and then the fifth one, which really sucks for you guys, is sleep.
Sleep.
Regular, quality, restorative sleep becomes so much more important after menopause.
Yeah, which
Getting
I
that
know,
rest
like
and recovery at night. And if you've got
yeah.
shift
Night shift
work,
workers, yeah, and the shift work kills everybody, man. It really does. It's
yeah.
rough. Yeah. I mean, we all know. Everyone in this group gets that. So they're like, there's you can only do so much in that sense, but do your best. You know what I mean? Get the kids out of the house if you have any, or have family, or the dogs. Try to get some good quality sleep.
Yeah, and do you know, have you ever watched any Andrew Huberman podcasts?
I don't think so, no.
I'll see if I can find one for you. He's
Yeah.
a neuroscientist at Stanford, and he does an
Okay.
amazing podcast. But he did a whole series on sleep with Matthew
Mm,
Walker, and they had one about shift workers and sort of
okay.
some slight lifestyle adjustments, some food adjustments, some supplements they talked about that can certainly help, especially if you're
Yeah.
switching from one shift to another, which
Yeah, that's what
many
I
of
used to do
you
a lot of. Yeah. Well, 2 weeks a day shift and then 2 weeks a night shift. So like you never
have.
really leveled out
Right.
at all. So, and I know a lot of people here are the same way, or they're trying to get back on a day shift schedule after their night shift, which is again super hard to do.
Yeah.
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 Cool. Let's see if anyone had any other questions. We also talked about medications because I know a lot of doctors are like, hey, let's put you on this, that, and the other thing to kind of help with your medication. Oh, good. Yeah. Amy says she feels so much better since she's changed to 8-hour shifts. Yeah, 12-hour shifts beat you up. But medications, right? Because obviously we know we go to the doctor. Well, I'm starting to feel like I'm on menopause and they want to put you on a bunch of stuff. And then a lot of times people will come to me and tell me like they feel like they're gaining weight because of those medications. So,
Yeah, absolutely. So, I mean, we touched briefly already on
yeah.
HRT, which is always like the controversial one, if you will.
Mm.
And again, that is absolutely a discussion for you and your physician, very personal
Oh, yeah.
decision. Um, I will say, just my personal opinion, there is a lot of evidence about the benefits of it these days in terms of bone health and just minimizing those symptoms that can be debilitating for some women. But there are some people who are just some women who are naturally excluded because they've had certain types of
Yeah.
cancer and so on before. Um, Other medications that are very common are you will go to the doctor and say, I've gained weight, and they will run a very high level limited thyroid panel and then say, oh, you probably need some thyroid medication, which
Mhm.
can, if
Yeah.
it's the wrong way, it's totally.
Yeah.
And they tend to just do TSH. They tend not to do T3 and T4 tests because they're not standard on most insurance policies. And it's a very high level test, and they may well throw you on a thyroid medication, which honestly may or may not be what you need. The other thing that happens very frequently is you're going to go through the mood swing thing. I
Mhm.
hate to say it. You're
Yeah.
going to have some rather erratic moods and a little bit of brain fog going on. And so many women end up being put on antidepressants.
Mm. Yeah.
And many of those, especially the SSRIs, can lead to weight gain.
Okay.
And you can definitely go through a cycle of feeling a bit blue, a lot of sadness and those kinds of things. It's a phase that a lot of women go through going through menopause. It doesn't mean that you necessarily need an antidepressant. It
Yeah.
might be the first time in your life you suffer from something like that. It may be the first time in your life you get anxiety. Very common, but it is a phase that you will go through. Now, if you genuinely feel that it's a medication you would find beneficial, then of course, between you and your doctor. But just know that it is something that tends to be very quickly prescribed and isn't
Hmm.
necessarily something that you want. They're very hard to get off once you get on them. They can be quite addictive. And they, again,
Yeah.
like all medications, they have other knock-on effects. So they can mess with your appetite, but they can mess with other hormones as well. And you've already got a
Uh,
big change going on in losing your estrogen. So it's a time to be very, very educated as much as you can. And again, that
yeah.
NAMS website I gave you has a lot of really great information on it.
Yeah, we'll definitely check that out. I'll probably like drop it in the group as well so people can have a
Yeah.
look on it. All right, sweet. I think what else do we come? I know we talked about a couple other things. It was a more like, oh, the frustration side of things. When you start to reach that menopausal age on the weight loss. So be patient with yourself. That's like one thing I work on with clients too, is just the mindset shift because, some people will see weight loss fairly quickly and then others it might take a little bit more time. Like you can't
Yeah.
predict how the body's going to react when you start losing weight and things like that. But as long as you have some sort of program in place that you can follow and make sure that you're following all the steps and doing the correct things, right? It's all about consistency too. I see so many people that, they struggle, but they're not being consistent in what they're doing. So at least be consistent with like the protein intake and getting some sort of activity level in and, just being aware of your stress levels because those are going to really play a huge role, in that weight loss. So, if you're feeling frustrated and you haven't been doing it very long, that's another thing too I see is a lot of people they're not doing it for an extended period of time and they're ready to quit within the first even like I would say over a month. Like you got to really wait for some time. Like people want that quick fix 30 days or less. It might take a little bit longer than you initially think, especially as we
Yeah.
age, right? Our bodies are not nearly the same as when you're 18, 19, 20 years old when you're like, well, I
No.
used to be able to eat and do whatever I want. And then you keep that same mindset as you progress forward. Like my training personally has definitely changed. And
Yeah.
I'm only 31. So as I see, some people that are still doing the same thing and expecting the same results as they age, you have to kind of, reassess and take things a different route. Because that's mostly like a step that a lot of people are missing for sure.
Yeah, for sure. And like those five pillars that I mentioned earlier are all important to managing your weight as a postmenopausal woman. Nutrition is, of course, the cornerstone of everything.
Mm-hmm.
Um, and I always get really dirty looks when I can see people when I say this, but sugar intake and decreasing your sugar intake becomes more important because you've got that decreased insulin sensitivity with the loss of estrogen. Sugar is going to be much more impactful on you than it was before.
Mm-hmm.
And just remember that, it's hidden in so many places in food these days. So it's a good time to really work on getting off the processed foods and, the processed carbs, particularly at this age. Lots of fruits, lots of veggies, the usual stuff. Um, and honestly, change your exercise at this time. I mean, Megan and I both said it earlier, but literally pick something heavy up.
Yeah, for sure.
Lift something heavy. You are losing muscle mass from
Yeah.
age 30 onwards, but you are losing it much faster with no estrogen.
I'm gonna work
And
on that.
so,
Yeah, the bone health too, right? Because I mean, the older you get, like how many people do I know or that as they age, they're like they fall, that they break a wrist or things like that. But you got to remember, like a lot of times they're not really focusing in on things like that, in terms of making sure they get their nutrition in and their workouts. So bone
absolutely.
health is
Yeah.
huge.
So it's lifting something heavy to maintain your muscle mass, stay strong, stay supple. So like functional movement as well. Worry about your flexibility and your stamina and your balance and all those things, because it comes down to, at this point for me, exercise is about staying strong. Yes, we want to look toned and we want to have that nice shape. Of course we do. We're women. We have a bit of vanity going on. We all do. But more importantly, we want to be strong old ladies, not
Oh yeah.
frail old ladies. We need to be training for longevity at this point. We all know that story of that more senior lady who fell and couldn't get up, and it was days before anybody found her, right? Because she didn't have the
All
strength to
right.
get up anymore. So we need to be strong, especially these big muscles at the lower half. We need to make sure we can get up if we
Yeah.
fall. But we want to be strong enough to avoid the fall in the first place, is even better.
Yeah, yeah, I know. That's a lot of it's a lot of things that I work on with people too, is like increasing their endurance, their stamina, like their balance, the stability. So all
Yeah.
those things are very important. And if you're just walking on a treadmill and stuff like that day in, day in and day out, you're not really working on those things. You're just doing what you're normally doing. So, you someone pushes into you, you know what I mean? You might not your leg strength's probably not there. You're gonna fall over.
Totally.
Um, yeah, so all that stuff is so important.
Very definitely. Yeah. Like, please be able to do at least one pull up, like, so you can pull yourself off the floor on the couch.
Yeah.
I know it sounds silly, but you know, and that starts to happen from 45 onwards. So we don't want to be. And there was a study came out. I don't know if you saw it. Peter Attia was talking about it. A break of one of your big muscles, so your femur, your hip, something like that, at 50 plus, you have a 30% increase of death the following year. That's
Yeah,
pretty
which is crazy.
sobering. Pretty
Yeah, like
sobering.
yeah,
Yeah.
right. Like, yeah, there is some, there's benefits everywhere when it comes to just getting your health and your fitness in check. So, I feel like we hit like a lot of good
I
stuff.
do
Anything else
too.
you think of, Kirstie, that you could kind of go over anymore? Or I don't know if anyone has any questions you want to get before,
Any
she jumps
questions
off.
come on?
Yeah, I'm
Well,
gonna
I
see
mean,
if,
if there's anything comes in afterwards, I can
yeah,
certainly get
Sean,
back to you. Yeah,
yeah, group
yeah.
and go
But I
over.
think we covered the basics. We covered the important parts, most definitely.
Yeah, for sure. So it's good. It's good. Hopefully, you guys got a lot of knowledge off of this. My goal for this year is to bring on some amazing guest speakers so we can have some other voices in the group besides myself. And it's always good to have other people that have a very good experience. Like, you know what I mean? Like someone that can speak for women that she's helped over so many years. So I'm glad you guys liked it. And if you, like I said, if you think of any questions or for those that watch the replay, just be sure to type it in here. I can always relay it over to Kirstie so she can give me some feedback if I'm not 100% sure on the answer, right?
Yeah, I'm more than happy to. Anything I can do
Yeah.
to help. Awesome. It's
Awesome.
been a pleasure. Thank you for inviting me, Megan.
Yes.
It's been
Yes.
lovely.
Yes. I had a great time and it was great catching up with you too.
You too.
All
You
right.
too.
Talk to you later and I'll text you, girl. All right.
Sounds good. Have a
All
good
right,
night.
later.
Bye.